the different staff from the different departments.
According to Uganda's 2025 State of Population report, about 22.9% of children in the country are affected by mental health conditions, yet fewer than 1 in 10 receive proper care. To address this growing concern, the Ministry of Education and Sports, in partnership with Raising Voices, has launched a new guide aimed at promoting positive mental health in schools.
And our work is really aimed at mitigating. So we see so many cases of mental health problems. Sometimes when a child commits suicide is when the whole community is alarmed. But by the time the child gets to that level, there are so many things that have happened that could have been mitigated.
Speaking of the launch, Director of Education Standards Francis Atima said mental health challenges among learners are on the rise. She pointed to causes such as bullying, corporal punishment, stigma, and family-related stress. Atima emphasized that mental health should not be treated as a one-hour lesson, but as a daily priority in every school.
Issues of mental health cannot be segmented within certain hours. Issues of mental health should be an issue that all schools and all teachers and everybody related to children or working with children from our families need to be part and parcel. So we should not be dedicating like 1 hour of a school day to only issues of mental health, no. Because it triggers, the mental health triggers can happen at any time of the day. And so children should be free, should feel comfortable that they can walk in at any time and discuss with the teacher on issues around mental health. So our proposal is that we shouldn't be looking at it as something extra, because we cannot talk about a child who is studying, a child who is going to achieve learning outcomes, if their mental state is wanting.
Experts say schools play a critical role in preventing mental health challenges before they become severe.
So those changes that are not normal for a child, if you see personality traits that have not been the norm for the child, it's an indicator for you that there is a challenge with their mental health.
The newly launched guide helps teachers and learners identify early warning signs of mental distress. These include sudden behavior changes, poor hygiene, withdrawal from friends, and declining academic performance. It also promotes open conversations and simple coping skills to help manage stress.
So the guide is providing us language. For example, if a child walked up to a teacher and said, "You know what, I am feeling scared," you know, that feeling is coming from somewhere. So the guide is helping teachers and learners be able to recognize things like that.
The guide also highlights the strong link between violence and mental health. Studies show that abuse, neglect, and bullying significantly increase the risk of anxiety and depression among school-going children. Building on programs like the Good School Toolkit, the new guide will help schools create safer, more supportive environments where learners feel heard and respected.
Through the different chapters